relationships, because we did have good relationships, but the world perceives us as having been bad to our friends. You know, hey, we played ball with them and just, hey, we're close. It's a misconception.
This isn't a question, but I was a patient of Dr. Ormand's for many years. And when I first came to the area, I had an Irish setter. Dr. Ormand had an Irish setter, so we spent most of our time in the exam room talking about dogs. And we still do. I mean, we stop outside and chat about dogs.
We love dogs, to say the least.
What other job did you get him?
Well, he delivered Derek.
I was gonna say, who else had a baby delivered by Dr. Ormand?
Do you have an estimate how many babies you delivered over the years?
My daughter counted them up some years ago, and she came up with something like 7,000. And you know, that's partly why I'm having trouble functioning now, because I lost a lot of sleep. You know, babies like to come in bad weather and at night. It's Dr. Y'all forgive me for this, but Dr. G.M. Smith uses to always say they come exactly 40 weeks, exactly to the time that they were conceived. If you knew Dr. Smith, he told it like it was. And he was a wonderful doctor here for years. But
Ever delivered a baby outside the hospital?
have
A car or anything?
my dad did when I was a kid, and he said, "Son, go out and clean up my car." But I never delivered one in the car. Never delivered one in the elevator trying to get to the labor room. No, I didn't do. And I delivered one or two over in Zimbabwe, or Zambia, excuse me.
How fast have you gotten that Porsche on the way to a delivery?
Well, that was my excuse to have it. and I generally was ignored by the highway patrol and everybody that knew the car. So I could just go like I wanted to, as fast as I wanted to, generally speaking, unless it was some new patrolman.
Are you afraid to tell me how fast because Sally's here?
It was a little easier to get somebody to come in and take the practice for me for a few days and leave them the Porsche to get to the hospital. Because it was fun to drive.
So with your practice, were you by yourself, or did you have any other doctors? Like today, they have the offices with several doctors to cover. Yeah.
I was the first OB/GYN.
Oh, wow.
Most all the babies were delivered by the primary care docs, and including my father delivered a lot of them. He delivered a lot of them at home, and he always said the best thing that ever happened was when we quit trying to deliver them at home. He said, that's not the place that you want to be. Now, it works out most of the time, right. But once in a while, if you're in trouble, you're in big trouble. Now, what are you going to do? So that's what he told me. I never delivered to anybody at home. Not.
When you were a teenager, what were the teenager things to do on the weekends, like Friday nights and the weekends when you were growing up?
That's a good question. What we did. I can just say the teen years were really wonderful. The kids were really good kids with ethics that you don't seem to see nowadays. Our focus was on, well, we knew if we didn't do it, it'd get home to mother and dad. So, I mean, we had somebody watching us the whole time. Anybody that saw us anywhere. I know Dad used to let me use his car, and he had a car that was identified. My dad was a GP in Monroe, and he had an Oldsmobile, a tan Oldsmobile. He had the first hydromatic drive automatic transmission in Union County. And he used it throughout the war. He put something like 300,000 miles on it because we didn't have many doctors here during the war. And Dad did home care. I mean, if somebody was sick and he had to go out to see him, he did. So he put a lot of, he went out to Camp Sutton. He helped out there. We never saw a father. My mother raised us. But we were watched, you might say. And we knew it would get, I got stopped one time and said, we wondered who Dr. Ormand was with. They didn't realize that I was driving his car. So what it showed me, one day I got somewhat of a little race going down the road. And Dad asked me that next day, said, son, where were you going down Wolf Pond Road so fast? And I'm thinking, how did he know that? Well, he knew it because he had patients all up and down Wolf Pond Road. They knew his car. Everybody in Union County knew his car.
Okay.
So I was a marked kid. I couldn't get away with anything.
Wayne, did they have a teenage club when you were around?
Yes, they did.
Was Bertie?
Teenage club was a wonderful thing.
Yeah, it was.
Yes. The teenage club was, this is where everybody went. We had square dances. The teenage club was a tremendously positive thing for growing up kids.
Was that the place near the big courthouse?
It was right, it was where the courthouse is now.
Where the courthouse is now?
It was down the street,
I've heard a lot about it.
down towards the railroad track on the right.
Near Bill Price's old office?
It was, I missed that last one with my darn hearing aid.
Bill Price, his office.
Dr. Bill Price.
It's Bill Price, his office.
Let me think who's down
I
here.
can't remember who it was.
Next to the old post office.
I'm having a little trouble coming up with it.
How did the healthcare work when you were starting out?
Well,
I mean,
this-
it's gotta be totally different in the way it is.
Oh, it is.
built into.
Healthcare is absolutely totally different. Y'all, I hate to say it, but it used to be a profession. And a profession is better than a business. Now, I know y'all are business people, but we're held to the standard of number one is the patient. It's not the business. That's not the way business works. Except it is the way that successful business, when people learn them, know them, and know who they are, and they put the patient first too. But we're taught to the patient's the one that counts. And it's pretty hard for that when you're owned by a hospital group and they say, well, you've got the code so that the hospital gets their proper and you can't spend but so much time. There never was a study that showed that 5 minutes or 10 minutes was enough time to evaluate a patient for anything. And everything we do in medicine has been studied and showed that insurance companies did that to us. They took that away. And so your folks are limited. They give you medical care. You got somebody looking over their shoulders. You can't have it 5 minutes, 10 minutes, whatever it is that they allow. There's been no real verification that that's adequate time. How can you learn about a patient's history and you've got to know what medicines they're on and what they're living amongst, what their challenges are. You don't have time to do that. Now we got so many wonderful advances in medicine that we didn't have. That's the good news. I mean, with in vitro fertilization, we could do some things to get people pregnant, but we couldn't do it in vitro. That was a tremendous thing. The ultrasound really made obstetrics, I'd say, probably the biggest advancement was the documentation with the ultrasound. So we knew how far we could get an ultrasound. We know how many babies were there, how far pregnant they were, if the baby had any sort of appearance that might appear at birth, so to help you to have that baby born where you could best deal with it. So that I'd say in obstetrics, the biggest thing was the ultrasound.
How far in your career were you when the ultrasound came out?
It was early. I did my residency at the University of Maryland. I went, I was at med school and everything at Carolina, but in Chapel Hill, we didn't have a lot of clinical material. Chapel Hill was just a city, it was not a town. You didn't have a big hospital. Now, they built one there, but it was a referral hospital. So there were not a lot of what you call indigent patients. So they farmed us out to some of I was down in Lawrenceburg, in Lumberton for couple weeks or so, and got to deliver babies down there by myself. I wouldn't have got to do that in Chapel Hill. So, it's. I forgot where I was going, y'all. I will tell you this. I got to do a little bragging. You might think that big things that happen, or when I say big things, unusual or advances that happen, don't happen here in Monroe. But back in the late 60s, there was a patient that showed up that we used to have problems with people that were RH negative. People that were RH negative and had delivered a child that was RH positive, we'd pick up some of the blood cells from the delivery of that RH positive child, and it would be like an immunization. And it was an immunization against an RH positive baby. And what it did was it destroyed the baby's red blood cells. And these babies would be born dead, or they'd get what you call coronary ictus, jaundice, and that would hurt their brains. And it was a terrible thing to be an RH negative person in those days. And basically, had a patient show up that was RH negative. When I checked her out to see if she had a problem, yeah, she had antibodies against RH positive blood, and she was pregnant. She was literally pregnant. And I thought, what are we going to do? Well, we're going to have problems. When I had been when I had been an intern in Cincinnati, I helped do some exchange transfusions with these babies when I was on pediatrics. So I knew pretty much it was not a good situation. But I had read about a new test that you could do, where you could stick a needle in the uterus. Nobody used to stick a needle in the uterus, and now it's common. If they need to get some fluid to have it analyzed or whatever. But in those days, you didn't know whether you were going to hit the fetus, or you didn't know where the placenta was. I mean, you didn't have the information you've got now. You was a shot in the dark. So anyway, you had to get some of that amniotic fluid and measure the bilirubin content. Now, the bilirubin was a breakdown of the red blood cell, and I did it, and it didn't look good. The information I had read had come from Australia. They had done the big research on this, and the research told me that this is what I needed to do, and I needed the pathologist at the hospital lab to run the scan to tell me how much bilirubin was in there. It's a certain wavelength and spectrophotometer, if I can say it right, that you have to measure this blip in. And he did that. He came down and filled in, you might say. He was a pathologist. Anyway, he did the work on it, and came back with this ominous report. And I talked to my friends in Charlotte, which was a referral center. We don't know about this. We don't have any ability to function about this. Well, what you used to do, we didn't have a pediatrician in Monroe, and if I had somebody that was RH negative, sensitized, and I had them delivering, I called him, and he came down, and he was here to take care of that baby from onset. We had no pediatrician, so he was here. But in any event, I'd have to call him. So anyway, we come up with this, and I'm trying to decide what can I do with this lady. And I go to an alumni meeting in Charlotte, and there's the new professor of OB/GYN at Chapel Hill. And I say, what's your big thing that you're bringing? He says, new treatments for RH negative. I said, oh, thank goodness. He said, you send me that patient and we'll do an intrauterine transfusion. I sent him the results of what the history was in this thing. I sent him up to Chapel Hill. They go up there, she goes up there, she's about 32 weeks or so. And that's usually when you begin to lose them. And I walked in and they sat me down in front of while they were doing the procedure. And I've always been a med student. I'd never been an honored guest, you might say. And here I was this is what we're doing. Are you okay about it? Yeah, I'm okay about it. Yeah, I'm okay about it. And they did it. And it was successful. They said, now we want you to deliver this baby within about 2 or 3 weeks from now. I said, well, this baby needs to be born in Chapel Hill. They were going to say, please, let's you keep her up here and you be up here with us. And the baby was born and survived, and everything turned out well. Now this was the first intrauterine transfusion in North Carolina. And it came from a Monroe patient.
Do you remember about what year that might have been?
That was around, I'd say 68 or 67, somewhere in that time. Yeah. I remember that so vividly. Nowadays you give a baby Rogam when the baby's born. If the baby's RH positive and the Rogam destroys those cells, so the mother doesn't get sensitized. So you don't see it anymore much. It's extremely rare. You can see a sensitization to some of the subgroups, but you don't see that anymore. Thank goodness.
So Lonnie, I know after you went to Chapel Hill and all, you came back to Monroe and you met Sally. Can you tell us about how you met Sally? And I know she was up there at Chapel Hill too.
I kind of did it because I was a nurse one summer. They were short of nursing staff at the university, and so they paid us medical students to stay and work as nurses for the summer time that we were out of school. So there was a group of us that did it, and of course we were working with the student nurses, and we could tell the interns and the residents and everybody when they wanted us to do something like a medical student. I'm not a medical student, I'm a nurse. Go jump in the lake. And so we got to be, you got to be, understand them very well and to work with them and to know them. And so she was a student nurse there, and and, I was lucked out.
I was running a clinic, and so he had to do whatever I told him to do. That's still true.
And he still does.
You know, it was a fun and actually we got paid. We got paid while we were nurses. I mean, we got nurses' salaries, y'all, and that was better than having to just pay to go to school and everything. So it was a fun time. Everybody I'll digress a little bit. Most of the other guys got put up on the private floors, and I got stuck down on the floor with just bad, sick, indigent patients. And man, I worked my tail off as a nurse. I did. The others, they were on the Gold Coast, but I wouldn't. No, I saw some things that would bother you to see. Let me just say it that way. To my short nursing career.
So Dr. Ormand, with the big push for some doctors and doctor offices to have physician assistants, and for patients to see the physician assistant, the PA, before they even get to see a doctor, what's your opinion about that?
Well, let me just say this, that after I retired from hospital work, and that was around 2002, Sally sent me to work with the health department and taking care of the indigent. She wanted to get me out of the house. I was telling her how to run the house. She didn't appreciate that. So she got me a job up there at the health department. And basically there, as time went by, we got PA students from Wing It, and to get their experience in women's health. So all our patients were indigent. So we had plenty of people for the Wing It students to do exams with and to take care of and under our supervision. So I got to see those PA students. And let me tell you, what I saw that came out of Wing It was awesome. These PA kids were smart. They were well trained. Wing It is a huge resource for medical care here. Thank you for Wing It. The PA department is great. I would not hesitate being seen by a PA. Not a minute.
Dr. Ormand, I know you've been such a blessing to this town. Was it always a goal to come back to Monroe and practice? You weren't ever swayed by being in Cincinnati or anywhere else to not come back home?
Yeah, well, I had an offer to go to Salisbury, Maryland, on the eastern shore of Maryland while I was up there. And Salisbury is a very nice place to live. It's kind of southern in a way, you know. But it's near the beach and the fishing's good there. I like to fish. And so I was sorely tempted, and my dad was talking to him about it. He said, "Son, I just want you to come home and just say if you don't like it, you don't have to stay." But it says Monroe, Union County is full of good people. It's a place to be. That's the best advice I ever had. I couldn't have been happier than I've been here.
This town should be thankful that you did.
Isn't that the home of Purdue Chicken up there in Salisbury, Maryland?
I'm sorry?
Isn't Purdue Chicken up there in Salisbury,
No.
Maryland?
Purdue Chicken.
Purdue Chicken.
Oh, yeah, so Salisbury, Maryland was chicken place, you're right. No, Salisbury is a great town, and it's a great place to.
I was offered a job there and I turned it down.
Is that right? Okay, well, Salisbury was very tempting, but hey, listen, I owed nobody anything when I got out of medical school. Dad had paid for everything. And the University of North Carolina was a lot cheaper than the private medical schools were. You can't imagine how much less you pay as a student in Carolina than you do in the private schools.
You have siblings? You have siblings?
I have a brother. And, he's an older brother, and of course, he's all Carolina. He's a physician, and he did OB/GYN in Wilmington.
Wow.
And I kind of followed behind him, so to speak.
Sally, where are you originally from?
I'm from West Virginia. Who's in there?
West Virginia.
West
You
Virginia.
gotta mention the
Buchanan.
county or at least the town or whatever it is.
Buchanan, yes, and there's a small, well, it's not so small, college there, Methodist college, lots of Methodists in that area. And, so I grew up with a lot of, extended education there because of the college and what they offered and what we were, interested in doing. And my mother was a teacher. She taught English and history and French for a while. And so then I had to kind of do, whatever she wanted done. So then I learned when I was sitting in the car, and I wanted the window up, I would say, "Fermez la fenêtre." So, little things come along this way.
So who delivered your babies?
Gary did, I guess. I don't
Say that
know.
now.
Who delivered which one? I mean, I went to the hospital I felt like it was time, and I said, I'm not leaving this place until I have a
You
baby.
talk about Sarah now. That was our, we have daughters 21, 22 years apart.
Wow.
They're two only children. We never had but one child at home at the time. And, I had patients come and say, "Dr. Ormand, I heard your wife's pregnant. She's older." Yeah, I said, "That's true." She said, "Don't you let that happen to me."
That's funny.
And hey, I was proud of it. We've been praying to have another child for how many? 20 years.
Grandchildren, do you have, can you tell us?
Yeah, I have, we have 4 children.
We have.
No, wait a minute. We have 2 daughters.
We have 2 daughters.
We have 2 son-in-laws.
That's 4, there you go, that's good.
And, we've got 4 grandchildren. And we've got we got more great-grandchildren. We've got we got 4 of those. we got 4 grandchildren and 4 great-grandchildren.
Wow.
And the great-grandchildren are older than the grandchildren. It's a confusion. You understand why I'm confused. Let me say this to everybody. I believe in trying to take care of yourself in longevity, okay? Please get your exercise. Please watch your weight. Diet and exercise are the keys to longevity. Now there's exceptions, but if you really want to get there, don't have bad habits like tobacco, too much of obvious things like that. But as you live, stay active, stay in the middle of everything, get out and exercise, and fight against the demons that